Hi, I'm Dr. Wong. I'm a consultant cardiologist. So today I want to focus on a patient who has a palpitation causing a stroke. This is a Professor Gregory Lip. He's from Malaysia. He has done big studies. Patients who have a calculated score. So there are two scores that he calculates. One is called the Chad-West score, and another one is called the Hasbled score. So when they calculate the score and it shows that the risk of stroke is high, then you must take a medicine called anticoagulation. So for last 30 to 50 years, the traditional medicine that we use is called warfarin. So warfarin has been around for a long time, but a lot of side effects. It also can cause bleeding if you take some medicine. So now there's a new medicine. We call it novel oral anticoagulation. So this medicine is supposed to replace warfarin. This medicine doesn't need the regular blood test. You don't have to do the INR test, and you don't have to restrict your diet. It's more convenient for patient. And the third one is that there's not so much of drug interaction. So you don't have to worry that this medicine can affect the efficacy of this medicine. The only issue with this new medicine is that it costs much higher compared to the old warfarin. So those patients who can afford it, this will be the ideal medicine to take. So let's say if you have a stroke, what is the action that you need to take? So first, you must go to the hospital immediately because this is like an emergency. We call it brain attack, just like a heart attack. As soon as you arrive in a hospital, because of the symptoms that I mentioned earlier, the hospital will decide whether to confirm whether you have a stroke. So how do they decide? They do a physical examination and they will do an emergency CT scan. So the function of CT scan is to diagnose whether the brain has bleeding or blockage. If it is bleeding, the treatment is totally different. You have to go to the surgeon and the surgeon will decide whether they can wait or they will go in to remove the blood clot. And if it's treated properly, most patients recover completely. But if they have blockage and causing a stroke, then they will stay in the hospital, ideally in the stroke unit. They will be given some medicine to prevent the stroke from getting worse, and they will undergo physiotherapy and rehabilitation to make them better. So if you have a stroke, there are many issues involved. You affect your work and it affect your family members. So the caregivers are important, and a lot of patients with stroke may suffer from depression. So this is some psychological effect that as doctors we have to address.